Go, we're live.
Hi everyone, my name is Kushbu and I completed this work under the mentorship of Dr. Soares at Western Michigan University School of Medicine.
I'm Jason Fogler from Boston Children's Hospital. My colleague Georgios Sideridis and I had the pleasure and honor of working with Kushbu and Dr. Soares.
Yeah, and so here we discuss the latent class analysis, understanding adaptive and behavioral profiles of autistic youth with and without co-occurring mental health and neurodevelopmental disorders. So the clinical presentation of autism spectrum disorder is pretty heterogeneous and relies heavily on observation of behavior and the utilization of various assessments and tools. So this can create a pretty ambiguous process with unclear diagnostic accuracy among clinicians. Latent class analysis can be a useful statistical procedure for understanding these diagnostic subgroups and developmental trajectories among children with heterogeneous manifestations of autism. And so the main objective of this study was to better profile and contrast groups with and without autism on two different subscales, the Basque and the Vineland, so that latent profiles of psychosocial origin could be recognized. And to achieve our objectives, we completed a retrospective chart review that was completed at the Western Michigan University Homer Stryker MD School of Medicine Pediatric Autism Center for patients between the ages of 0 and 18 years who had undergone a multidisciplinary diagnostic assessment for autism and other associated comorbidities. In this, we collected data such as age, gender, assessment scoring on the Basque and the Vineland, autism diagnoses, and other associated diagnoses for 191 discrete patients. And then latent class analysis was utilized to investigate any key differences between these groups, between latent groups, and then to contrast groups with and without autism across different subscales on the Basque and the Vineland.
George subjected these 191 cases to latent class analysis and found that a 4-class solution fit the data best. I'm going to show you those 4 classes now. So here we have on the top line with the X's, very high rates of psychiatric symptomatology on the Basque, very low adaptive functioning on the Vineland. We dub this group a profound autism or very low functioning group. With the dark dots and the dashed line, we have relatively high levels of behavioral health symptomatology, intermediate levels of adaptive functioning. This was the group that had the highest number of comorbid mental health disorders, including mood, anxiety, and disruptive behavior disorders. We call this a behavioral health disorder group. In the gray squares, coming up with the dotted line, we have intermediate levels of symptomatology and some low, moderate levels of adaptive functioning. This turned out to be the group that was a pure autism spectrum disorder class with no other comorbidities. Lastly, with the diamonds, we see intermediate levels of psychiatric symptomatology and very high levels of adaptive functioning. This was a group with high functioning autism and high rates of other neurodevelopmental conditions, such as communication disorder, ADHD, and learning disabilities. Quickly on the right, blue line, non-autism spectrum disorder, dashed black line, autism spectrum disorder. Interestingly enough, and these are kids who are all coming to a neurodevelopmental disorder clinic for assessment of ASD. Interestingly enough, the BASC-3 scales that usually differentiate ASD from non-ASD, scales like atypicality, withdrawal, functional communication, actually didn't differentiate these groups nearly as well as Vineland scales. Something to think about for the future.
So in general, why does this all matter, right? With the challenges of access for diagnostic evaluations and functioning in a healthcare system where we have to first diagnose and then treat, latent class analysis using standardized rating assessment data can offer a path forward for clinicians that are hoping to triage and support families of children referred for autism and other psychiatric and neurodevelopmental disorders.
Thanks for your attention.